is Giselle. I'll be your nurse today. I'm going to go ahead and perform hand hygiene. I'm here today to perform your head-to-toe physical assessment. Can you go ahead and identify yourself by giving me your full name and date of birth?
I'm Abby Strickland, and my date of birth is 9/20/2005.
Okay, I'm going to go ahead and verify the information that you've given me by checking your wristband. Okay. All right, well, I'm going to go ahead and begin by asking you a couple of questions. Could you tell me where you're at right now?
In the hospital.
Yes. Could you tell me what day it is?
Thursday.
And could you tell me why you're here today?
For a physical assessment.
Yes. All right, and are you in any pain right now?
No.
No pain? Okay. All right, and for your vital signs, I've already checked your vital signs. They're within the expected limits for your temperature, respiration rate, heart rate, and blood pressure and O2 stats. Okay, so patient appears alert and oriented to person, place, time, and situation. Their gait is steady, speech is clear, posture is erect, and affect is cooperative and calm. Okay, so I'm going to start off by assessing your skin. So do you mind if I touch you? Okay, well, I'm gonna start off by assessing your face. I see that your face is symmetrical and intact. Okay, so I'm gonna touch your skin. Skin feels smooth and warm. All right, your abdomen. Right, your chest. Okay, so skin is even in color throughout. It is pink, uniform in color. It is pink, it is warm, dry, intact, and smooth. And I also didn't notice any lesions, no edema noted. And I noticed a little bit of bruising around her piercing, but that's because it's still healing. And no scarring, or no scars. Okay, so now that I've assessed your skin all throughout your body, head to toe, I'm going to begin by assessing your eyes. Okay, so see that your conjunctiva is pink, your sclera is white, and your cornea is clear. Okay, so I'm going to flash a light in your eye. It's going to be a little bright. Okay, so I'm going to do this side first. And I'm assessing your perla right now. Okay, I'm going to have you look across the room, and when I tell you to, I'm going to have you look at my pin. Look at the pin. Okay, so pupils are round and equal in size. They're reactive to light and they are accommodating. Okay, so now I'm going to assess your ears. Let me know if you feel any tenderness while I'm touching them. Okay, no tenderness. Okay, I also don't see any redness on that side. Do you feel any tenderness?
No.
Okay, I also don't see any redness. All right, so now I'm going to assess your nose. Can you cover one side of your nostrils and breathe in? You can do the same thing to the other side. Breathe in, breathe out. Okay, can you breathe through both of your nostrils? Okay, so your nares are patent bilaterally. Okay, so now I'm going to check the inside of your mouth as well. Before I continue, I'm going to check your hearing. I'm going to whisper something to you and just repeat it back to me.
Can you hear me?
Yes, okay, so hearing is also intact. Okay, I'm going to check the inside of your mouth. Can you open your mouth for me? Okay, so I see that your mucus is, or your oral mucus is pink and moist. Your dentition is intact, and your uvula is midline. Okay, so that's it for your face. Okay, so now I'm going to assess your upper extremities. Okay, so I'm gonna have you move your head from side to side. Okay, move your shoulders for me. Okay, move your arms up and down for me. Extending your elbow or extending your arms, moving your wrists, your fingers. Okay, so you have full range of motion in your neck, shoulders, elbows, wrists, and fingers. And I'm gonna check your, we're seeing how you practice your restraint. Or can you push against my hand? Or resistance, okay? Check your resistance on the other side. Check your resistance on your shoulders. Your arms, can you push against them? Against my hands. All right. So, so you have full strength, again, in your neck, shoulders, arms, wrists, and I'm gonna check your grip strength. Can you hold on to my fingers? Okay, so I rate your grip strength a 5 out of 5. All right, so now I'm gonna check your radial pulse. Can you extend your arms out for me? Okay, so radial pulse is a +3. Okay, so now I'm gonna check your sensation. Can you close your eyes for me? And just let me know where I'm touching you.
Right arm. Left hand.
Yes, okay. And now I'm gonna check your capillary refills. Can you extend your hands out for me? Okay. Capillary refill, less than 3 seconds. All right, so I'm gonna continue by assessing your respirations. So I see that your respirations are quiet, with ease, and rhythmic. Okay, so now I'm gonna auscultate your lung sounds posteriorly and anteriorly. So I'm gonna start off with your anterior lung sounds. You take a deep breath for me every time I move my stethoscope. Okay, can you stand up for me? I'm gonna check your posterior lung sounds. Okay, can you have a seat for me again? Thank you. Okay, so your lung sounds were clear and didn't have any advantageous sounds noted. So your respirations were all good there. All right, so now I'm gonna move on to checking your heart rate and your rhythm. So I'm going to check for your apical or your aortic, pulmonic, or herbs, point, tricuspid, and mitral. So, and then I'm going to auscultate your mitral for 1 full minute. All right. Can you sit up straight for me? Okay, so I auscultated 82 beats for your heart rate. Okay, and okay, so now I'm going to move on to assessing your, oh, I'm sorry, and your heart rate was, it was rhythmic, or you had a regular rate and rhythm for the S1 and S2. You had no murmurs, no clicks, and no extra beats that were noted. All right, so now I'm gonna have you lay down on your back right here. All right, and now I'm going to reposition the camera. Okay, so now I'm going to listen to your vowel sounds and all 4 quadrants. Okay, so first I'm going to note that your abdomen is symmetrical and you have no dentition in your abdomen. Okay. Go ahead and listen to your vowel sounds in all 4 quadrants, starting off with your upper left. Upper right, or I'm sorry, upper right and upper left. Lower left. Lower right. Okay, and your vowel sounds were clear in all 4 quadrants. You had normal vowel sounds there. Okay, step in frame. Okay, and I'm gonna go ahead and palpitate your abdomen and let me know if you feel any pain or tenderness. Okay. Do you feel any pain or tenderness? Okay. Okay, I'm gonna have you sit up for me again. I'm gonna position the camera again. Okay. I'm sorry, I'm actually gonna have you lay back down. Okay, so I'm gonna check your range of motion in your lower extremities. So can you move your leg, one leg at a time, just up, or raising it? There we go. Okay, you can do the same thing to the other leg. Okay, I'm gonna put some resistance on it, and can you move your leg up for me? Do the same thing to the other side. Okay. All right, so now I'm going to check your resistance on your feet. Can you push up against my feet, my hands? Okay, so you have full range of motion and strength in your hip, your knees, your ankles, and your feet. Okay, all right, now I'm gonna check your dorsal or dorsalis pedis pulse. I'm gonna check that right here. Okay, so for pulse, I'd give it a +3. So now I'm gonna check your capillary refills on your feet. Capillary refill, less than 3 seconds. Good. All right, so now I'm gonna check your sensation. So I'm gonna have you close your eyes and just let me know where I'm touching you. Left leg. Okay. Right foot. All right, perfect. Okay, so that concludes your head to toe physical assessment. I'm gonna go ahead and have you sit back up. Okay, so I'm gonna leave you in a safe environment, ensuring that your bed is lowered all the way as far down as it could go. Bed rolls up if appropriate, as well as locking the bed wheels, ensuring that your colli is within reach, and ensuring that HIPAA is maintained while filling out your documentation. Okay, do you have any questions before I head out?
No.
All right, I'm gonna go ahead and complete hand hygiene before I leave. And that concludes your head to toe physical assessment.